I think as a person, an APP who works in a community setting that sees all sorts of cancer patients, not just GI cancer patients, I think it's really important for us to keep in mind to check on our other patients, whether they're being treated for breast cancer or GU cancer, to make sure they're still up to date on their colorectal cancer screening. Oftentimes, when patients are coming to us for treatment or surveillance, they're not following up with their primary care provider. And so they're not getting that recommendation from them, and it's falling through the cracks. So I think that's a really important take-home message, that if you work in a setting, a community setting, that you still need to maintain those routine healthcare maintenance for your regular patients, because sometimes you are the only provider they see.
Yeah, I think advanced practice providers are in a really special, unique position by the relationship we have with our patients, even especially nurse practitioners, but I think this can be generalized to our physician assistants. I mean, nurses and nurse practitioners are one of the most trusted medical professionals. So I think having communication and talking with our patients about the importance, the why behind the test and explaining it. I think there's barriers related to transportation. If a patient works and they're the primary breadwinner and they can't get a day off because they don't get paid, they're not going to take a day off to get a colonoscopy. So I think talking about, okay, so it's not just a colonoscopy, at least can we get you a FIT test? Will you at least do that to get us started? So at least there's some screening. I think another great opportunity for advanced practice providers are collaborations with other disciplines. I recently am in discussion with my faculty in the School of Nursing and my research scientists, and we have been brainstorming, like, how can we get out there in the community for screening? We have a mobile health clinic van that goes around, and can we get people FIT tests through there to get them started, to increase that screening, collaborating with churches and patient advocacy groups, that we could be the voice, collaborate with those patient advocacy groups that help with that medical mistrust. I think that is a pathway to help with that barrier. And APPs are in a great position. What if there's a positive test? What do we do with those results? We can help navigate that care for patients.